Dear colleagues, I'm very glad to be here and to be able to present some of the new approaches in teaching which we provide in the Faculty of Public Health in the Medical University Sofia. I'm glad that I'm here with the other participants in this workshop from our university, Professor Petkova, the Vice Rector on Science and Education. So I hope that after the presentation, maybe they will also they would like to add something about our new approaches. Let me first say a few words about our university, because I would like to mention some of the programs which we have, because they're related to the approaches which we now develop, and we would like to extend to the other specialties in the university. The Medical University Sofia is the oldest and the biggest medical university in Bulgaria, with more than 100 years history. It has started as a medical faculty in the frame of the Sofia University, and now other faculties were created: dentistry, faculty of dentistry, faculty of pharmacy, faculty of public health, and we have also branches in other cities, and also a medical college where the training in so-called occupational bachelors, which are 3 years old in Bulgaria, while bachelor degrees are with the duration of 4 years. And the specialties which this is our rector's team, the statistics, we have a little more than 10,000 students in all the faculties in our university, 1,300 teachers, and almost 400 PhD students at the moment. And because the topic of my presentation is innovations in public health training, I would like to say a few more words about the Faculty of Public Health, which is the youngest one. It was established in 1995 as Faculty of Nursing, with the support of the Stability Pact and the World Health Organization. And since 2001, the former Faculty of Nursing has been renamed to Faculty of Public Health. And at the beginning, it was responsible for training of nurses only, while now it has, you will see now the structure and different specialties. We create more and more new, because we are responsible institution, and we would like to respond to the needs of the society, to new form of training and new professions which are necessary not only for the health system, but for the whole society in the field of management. The Faculty of Public Health, considering the need of new generation of health managers, provides appropriate education in different directions, as I said, in the dynamic process in healthcare markets. There are 10 departments: Department of Health Policy and Management, of Social Medicine, Nursing Care, which is the biggest one, Department of Bioethics, our newest one. I will say a few words about it later. Department of Occupational Health. I have the honor to be the head of this department. Department of Preventive Medicine, Department of Health Economics, Health Technology Assessment, Physiotherapy, and Medical Pedagogy. We provide training in bachelor, master, PhD degrees, and postgraduate training. I would like to show you some of the specialties in the Faculty of Public Health, because it is related with the approaches, educational approach, which now we develop, because we develop it for, you will see, one of the specialties, but it can be enlarged and it can cover the specialties and the graduates of other specialties as well. So the bachelor degrees in the Faculty of Public Health, as I said, in Bulgaria, bachelor degree is with the duration of 4 years. So we have bachelor in public health and health management, healthcare management, nurse, midwifery, physiotherapy, and physician assistant. Then we have many master degrees. I mentioned some of them, and they are towarded and they're focused to different groups of students. Some of the master degrees are towarded to students from the same scientific direction. For example, nurses can continue their education in some of the master degrees, bachelor also. So in Bulgaria, we according to the on the previous degree they have in the scientific direction, students can continue in one or other master degrees. So healthcare management is focused on nurses. Occupational health and workability is a master degree which can be students in this specialty can be medical doctors, but also engineers, economists, technicians, and other medical and non-medical experts. Strategical management in the pharmaceutical industry, medical rehabilitation and balneology, which upgrade the training of bachelor in physiotherapy, clinical trial management, and medical cosmetics. So each of these master upgrade the practical and theoretical knowledge of the previous of the bachelor, but of course and new management skills are acquired. In numbers, for the previous academic, actually the present academic years, in the Faculty of Public Health, there are 1,400 students in all our bachelor and master programs. 73 PhD students are currently preparing their PhD thesis. In the last year, 52 PhD students defended their dissertations. Of course, we follow each requirements of the legislation and all the accreditation criteria, which give us opportunity to open, to develop, to create new programs, because in medicine, dental medicine, and pharmacy, and nurses and physical assistants are regulated professions, which means that they have state requirements and determined program, while in some of the public health direction, we are able to create new forms of education in order to be of use of, as I said, of the society, to create new forms of training. We have participated in different projects. So this was the structure and the specialties in the university. Now I would like to give you some background why we focused on this new training approach. What was the necessity of this new training approach? The population of Bulgaria is a little more than 6.5 million people, according to the last census, while medical doctors are around 30,000, which, of course, as not only in Bulgaria, but all over the world, I think, is quite there is a lack of medical experts all over the world, also in Bulgaria. It's not because we don't train students. We train, I think, enough number. There are 5 medical universities, actually 6 already, medical faculties. We train, but unfortunately, it's a global trend, I think, that after graduation, more than half of our students, especially medical students, go abroad for better career maybe and better anyway, they don't stay in Bulgaria, so our system still feel this lack of experts, and the age of the medical doctors increases all the time. There is a statistics that there are not 1 or 2 cases that medical doctors of above 80 years old still continue working in surgery or any other specialties. Medical doctors, I said 30,000, healthcare experts, including nurses, midwives, physician assistants, lab technicians, roughly 45,000 medical experts. On the map on the right, you can see the density of the population. It is obviously obvious that the population, this 6.5 million people, are focused, concentrated in the capital, Sofia, where officially 1.5 million people live, but unofficially 2 million people live in Sofia. You can see the dark green parts. These are the biggest cities, so almost all the population of Bulgaria is concentrated on these areas. In these biggest cities, there are medical universities as well. Here is also maps of the density of the population. The left one shows the density of the population, and the right one is the density of the population above 65 years old. So you can see that the biggest part of Bulgaria is populated with old people, because we are also, like many other European countries, we are in demographic crisis with the population which is going older and older, and the birth rate is not high enough. Here is a statistic of the medical doctors and nurses, their ratio. You all know that the optimal ratio for the optimal activities of the healthcare system is 2-3 nurses per 1 doctor. In Bulgaria, you can see that from 2018 until now, these statistics has changed, and it's not even 1 by 1, 1 to 1, but in the last 2 years, we have, or even 3 years, the nurses already are less than medical doctors. So there is extremely extremely bad situation, and the activities, the medical activities, suffer of this decreased number. According to Eurostat statistics of 2020, you can see here, I'm sorry that it's in Bulgarian, but Bulgaria is on the 3rd of the last places by number of practicing nurses per 10,000 people. After us on this number, only Romania and Croatia, while the leaders in number of practicing nurses are Germany and Austria. You see at the right side of the graphics. So it's really worrying, the situation about the number of nurses. This is also a statistic of the population per one medical doctor. You can see that in green is the number of population per one doctor, 50 to 250, while there are not many places where the red parts are the cities and the villages where one medical doctor is obliged to take care of more than 2,000 people, which you understand it's impossible physically, it's impossible to do that. This is the number of medical doctors per one, and according to the big towns in Bulgaria, and only the towns where the cities where there are medical universities are those where there are enough medical doctors, because usually after graduation most of the medical doctors would like to continue their career in university hospitals or in bigger cities. So this is the statistics, which is of course very scaring about the situation in with our medical experts. That is why we, because of this lack of medical experts and especially nurses, in the Faculty of Public Health, we started a pilot study about, so I saw you showed you statistics about how many people per one medical doctor. Is the same with the nurses. Even if there are nurses in the distant rural areas, they are not enough. They are also usually after above 55, 60 years old. They also continue working till death. They are not able, these nurses are not able to do long-term training, or they're not able to have access to different guidelines or different courses. So that is why in response to this need, we decided to start this pilot project and to provide education of nurses, of nurses in emergency pediatric departments. The European Pediatric Association and International Pediatric Association Working Group published the recommendation for the effective management of pediatric emergency in 2021. And the primary recommendation was there should be effective cooperation among different European countries to ensure the availability, affordability, and accessibility of pediatric emergency care in all European countries. A common solution in this complex environment is to create a data-driven clinical guidelines that set a standard for pediatric patient care in the emergency department, included well-documented intervention for the clinical decision-making process in a specific group of patients and over a clearly defined period. Such pathways first appeared in New England Medical Center in Massachusetts in 1995 by Karen Zander and Kathleen Bauer, and they have also been introduced as e-pathways. We, in cooperation with colleagues from Greece, we started such a project because e-learning technologies and e-methods makes possible the delivery of this knowledge to rural areas. In Greece, there is also such problems with the rural areas as well in Bulgaria, where the lack of these medical experts and especially nurses is extremely high. The main objective of this agility, so-called agility project, is to encourage the development of innovative digital education practices to advance vocational training for registered pediatric nurses. This is our pilot group. And in particular, this is toward to develop innovative vocational training services for pediatric nurses as a beginning, address existing challenges to remote training provision and specific challenges to vocational clinical pathway education. Our aim is to incorporate ICT technologies in vocational training, develop digital content to cover the theoretical foundations of clinical nursing pathways. We think that by this way we will elaborate them and be of help in their everyday work in the emergency departments, and develop a simulation-based learning module targeting the practical modalities of this clinical pathway education. The expected impact of agility on the participant and also on participating organizations, target groups and relevant stakeholders is expected to be significant. We think that it can help our health system at least a little bit, as the motivations for implementation has stepped up on real needs among pediatric nurses, because one of the most deficient medical specialties in Bulgaria is pediatrics as well. That is why we would like to support the skills of the nurses, as they're not enough as well. This innovative teaching approach, we believe, will allow to bridge the skills gap identified by the healthcare system, promote the digital transformation and modernization of training institution in order to address the weakness due to the particularly of nurse workforce on pediatric emergency. This further extended due to the pandemic in terms of readiness, resilience, capacity, and adaptability. Promote the skills and knowledge of nurses in pediatric emergency. Promote the creation of pediatric emergency expert nurses institution based on adequate, innovative, and flexible methodologies that will support vocational training of students' profile. For the first, at this moment, we have collected different guidelines, and now we are at the period of the phase of the project when we develop guidelines, we create content of each module, and we believe that we will be able to start this training early next year, maybe January or February at most. So the impact of agility on participants will be measured by the extent to which they find it agreeable and feasible to implement agility open education resources. We will distribute questionnaires among trainers and facilitators, and among trainees we will have a focus group. So in order to receive a feedback on the programs, on the guidelines, and in order to be able to improve them. Here are the indicators which we will use the tools and methods, and the relevant indicators will be number of training best practices collected, 20 in total, 5 per country. As I said, Bulgaria and Greece partners in this Erasmus Plus project. And up to now, we have analyzed 10 good practices from Europe. Number of workshop for participants, number of training modules which will be developed at least for covering the different most widespread emergency situations, number of social media posts where all this information will be distributed, and number of reports downloads, at least 100. We believe that, as I said, that this is a pilot study. We think and we believe that when we develop such guidelines and provide training starting with pediatric nurses in emergency departments, will be the first step. And if it is according to the feedback, if it is successful, we can provide such guidelines and such algorithms to other specialties with the cooperation of the different societies, for example, societies of general practitioners, societies of here of midwives, of physician assistants, of medical doctors of different emergency specialties. So that's why I wanted to show you the different specialties which we have in our university, because we think that by this pilot study we can help, if other guidelines are developed, we can help the vocational training of other medical experts all over the country, because you saw how big parts of Bulgaria, and also we have the same statistics for Greece, are with not enough medical experts. And can you imagine if there is one medical doctor or one nurse or one physician assistant in an area that cover, for example, 20,000 people, how difficult it is for this person, medical doctor or nurse, to leave their job and to go to be trained in Sofia or in other big in another university, in other medical university. That is why, in order to provide them with care and with knowledge, practical and theoretical, it will be very useful for their practice. So thank you for your attention.
Thank you so much. Thank you so much for this really interesting look into the program that you're running and starting. It was a great and interesting thing to see what you're doing and the challenges that you're solving. Are there any questions from the audience? I can run around and hopefully this is working.
I think we are all academic teachers, so we can speak loud without a microphone. We used to speak without in front of students.
Yes. Oh, it's working.
No, it was very simple. The experience that you explained in Bulgaria in terms of you're training teachers, you're training nurses, or teachers, you're training doctors, you're training nurses, and while you're educating these doctors and nurses, they are leaving to go elsewhere to, it's a similar problem. We have a similar problem in Ireland as well, in the sense that a lot of our doctors and nurses are not Irish. Well, it's not a problem, but the doctors and nurses that we train go elsewhere to actually practice. So I suppose it's to do with the economy and all of those things as well as other factors as well. But I'd be interested in, have you got initiatives to try and make them stay?
I'm sorry?
Have you got any initiatives to try and make the doctors and nurses stay in Bulgaria?
Oh, well, this is a question. For example, everybody asks, this is not a problem. We, as representatives of the university, we do our best in order to train them. And obviously, because they're well trained, they find job elsewhere in the world. So this is a problem of their realization of. So it depends on the Ministry of Health, Ministry of Social Policy, and so on, in order to encourage them. But the encouragement depends on the easy way of, for example, of specialization, of career development opportunities, of living conditions, and many other factors. Social policy, and so it's not about. It doesn't depend on us. What we do, we train them.
And I was thinking the graph which is showing the ratio of nurses to doctors. I think when we look where the doctors are migrating from to, it follows a bit the graph that you showed. So the only thing we can do is educate and motivate more people to be and stay.
In Bulgaria, the percentage of nurses who go abroad is not so high. The problem is that the job is not very respectful. It's with high responsibility, very difficult job, but it's not so well appreciated by the society. Although there are attempts that the salaries increases, but maybe not enough. And we do the best what we can do. We increase the number of students which we enroll in nursery. But anyway, there are not so many candidates, and because the job after that is very, you know how responsible it is and difficult, and not so respected by the society. What's more, there were special we wonder how to encourage the students. The Sofia municipality decided to motivate them by special awards and grants during their fees. They cover their fees, for example. But can you imagine there were almost no candidates for that? No, because they are obliged to stay at the municipality hospitals for 3 years.
I come from Croatia, so I guess we were a bit lower than Bulgaria, so I can only imagine how things are.
Yes, it was a statistic from Eurostat, so you can see it.
And that makes then the doctors leave as well, because the environment has to be really tough. And comparing, for example, the Croatian and the Swedish system in this, how much the nurses are also trusted and respected for their work. There is a lot to touch upon, but that's out of the scope of this.
Yes, you saw the statistics that Germany and Austria have the highest number.
And then the nurses are there respected, and they have much more autonomy to do a job like that.
Yeah.
So, yeah. Thank you.
Thank you. Okay, thank you.
Okay.